my slides. Could I get my slide up? So my slide. Hey, Dr. Weiss, how are you? Nice to see you. I have this here. I don't have Mike yet. Good morning. Please take your seats. Our program will begin in 2 minutes, so please take your seats. Could I have my first slide? I'm getting feedback. Frank, there's feedback. Is it this? Testing? Testing? Is it good? Testing?
Ladies and gentlemen, please take your seats. Our program is about to begin. As a courtesy to others and our speakers, please silence all devices that make noise. Thank you.
Sound isn't.
Ladies and gentlemen, please welcome Mr. Dennis Wagner, Director of CCSQ Quality Improvement and the Innovation Group.
Very good. I love an on-time start. We're delighted to have you here. This is going to be a great conference over the course of the next 3 days. I have to say, I'm just stunned at how big this room keeps getting. You know, every year, somehow, the room grows out in either direction. We have a total number of 2,400 people who will be joining us over the course of the next 3 days, and we're so grateful to have you here. It's going to be truly a spectacular program. I want to just begin by acknowledging all of the different quality improvement networks and leaders who are present here in the room. We have the Quality Innovation Networks, the Beneficiary and Family Centered Care QIO networks, our end-stage renal disease network, state programs, hospital improvement innovation networks, practice transformation networks, support and alignment networks, and then our federal partners from CDC, ARC, and HRSA from across the country, many private partners, and a very special group. We take great pride at CMS and the Quality Improvement Innovation Group and CCSQ in particular in involving patients and families in the improvement work that we do. And sometimes, whenever we can, we actually bring them into the policy development work at CMS as well. And I want to just take a moment and invite the patient and family advocates who are present here with us this morning to please stand. We want to see who you are. We want to recognize you. We want to thank you. Great going. I want to point out a very special group of ESRD network patients who are kind of congregated. You saw kind of a bunch of folks over here on the left. They're going to be part of a very special award that we're going to do this morning during the course of our presentation. So celebration and recognition is one of the parts of this conference that I enjoy especially. I want to begin by thanking you for your hard work, thanking you for your commitment, and thanking you most of all for something quite extraordinary that's happened over the course, I would say, especially of the last 5 or 6 years. And that is the systematic teaming across and among the quality improvement networks that are funded by CMS and by many others. We have a whole new level of synergy and collaboration that's occurring in this country, and much of it is a direct result of the way our quality improvement networks are working with each other and modeling the very behaviors that we want to see more of in the U.S. healthcare system. So thank you for what you're doing. We are very grateful for it. So what are we going to be doing here over the course of the next 3 days? I have sort of 10 minutes here to kind of get us going. And this is kind of the essence, I think, of what's going to happen over the next 3 days. We're going to renew and we're going to refresh our commitments to purpose. We're going to be focused on our aims. We're going to be renewing our understanding of those aims and progress towards those aims. And in some cases, we're asking you to commit to new bold aims as part of this work. More on that in a few moments. We're going to strengthen and create new partnerships. These two things together, purpose and partnerships, are at the heart of resilience. And I think it's really important in today's environment for all of us in this room to be gearing up for another round of changes. We had an election. There's lots happening in the political environment that all of us operate in. And we know that there are going to be more changes. And we've had 5 years of changes, and I think we should expect more changes as we go forward. And the beauty of resilience is that it's what allows you to thrive and to prosper during those times of changes. And resilience, the fundamental core of resilience, are purposes and partnerships. And we've got that at extraordinary levels present in this room and in our work together. We're also going to have fun. Now, this particular bullet, I just want to acknowledge, I didn't have this bullet on here, and yesterday my colleague said, Dennis, this isn't all about the work, right? This is about having fun. And God knows we are going to have a lot of fun during the time that we have together. So get ready for some celebration and get ready for some fun. We're going to learn together, we're going to work together, and we're going to make commitments. Now, on the work part, I learned in 1991, I do like the work part. I learned in 1991, I went to a breakfast meeting. It was one of the best breakfast meetings I ever went to in my life. It was downtown Washington, D.C. It was hosted by the Council for Excellence in Government. And they had this man there. His name was Robert Kohler. He was the former associate director of the CIA, the Central Intelligence Agency. He was in charge of hardware and satellites and things like that. But he left CIA, and at the time I met him, he was the executive vice president for operations at TRW Corporation, which is a kind of a defense manufacturing organization at that time, at least. And he taught us in that breakfast session that work is 3 things. It's making commitments, it's delivering on the commitments you make, and it's securing them from others. That's the heart of real work. That when you do those things, you create the future. You make something happen. Now, these things, the first one and the third one, making commitments and securing them from others, usually is a product of requests and offers. So I want to be encouraging you to take action and making requests and offers to each other over the course of the next 3 days on our work. And God knows we have a lot of work to do. this is a beginning list of some of the work. Like this, I could have the next 5 slides, kind of listing some of the things that our powerful networks teaming together are doing to improve things in the American healthcare system. I led with the first 2, though, here about the quality payment program. You know, I talked a little bit earlier about making new commitments. You're going to hear a lot about these first 2 things from CMS Administrator Andy Slavitt, from Dr. Patrick Conway. You'll hear from Dr. Conway tomorrow. You'll hear from Andy on Thursday. And they're going to be asking you to embrace some new commitments and some new goals around the quality payment program. I think Kate Goodrich, who you'll hear from shortly, may also ask you, Jean Moody-Williams and others. So we've got a lot of work to do on this front. 90% of eligible clinicians participate in the quality payment program. That's an aim. That's a bold aim, and it's doable. And if it happens, it's going to happen as a result of the work of many of the leaders in this room. Now, I want to take just a moment. This is about working with, supporting, and serving clinicians. And we've got a group of clinician champions that are part of the quality payment program that have been working with Dr. Ashby Wolf, our Chief Medical Officer out in San Francisco. And I want to invite those people who are part of the QPP Clinician Champions, sort of on behalf of clinicians everywhere, that we need to serve well in the work of the Quality Payment Program, to please stand. Could I ask you to, those of you Clinician Champions with QPP, we're delighted to have you here. Now, since we've done that, there are a lot of clinician champions in this room. The Quality Payment Program, TCPI, there are a lot of clinicians in this room. I'm about to introduce one. The next person to come on the stage is a nurse and a clinician that I work with every day. Could our clinicians please stand? Nurses, nurse practitioners, physicians, specialists, intensivists. I got to get that celebration mode. This cowbell, by the way, was loaned to us by the American Hospital Association. It comes from the state of Mississippi. I had a cowbell, but it was like nothing like this one. Like, woo! Is that Mississippi? All right. They know how to make cowbells in Mississippi, apparently. So we got a lot of other work that needs doing. I'm not going to go through everything on this slide because we're going to be talking about it. It's the content of our conference for the next 3 days. Now, this business of commitments. Requests, offers, generating commitments that make the world turn. Think of it. We got 2,400 people here. If we each make a commitment, that's 2,400 commitments. If we make 10, that's 24,000. So I know you were asked to silence your cell phones, but I want to invite you to pull out your cell phones right now. And we're going to do our first online polling. All right? So you got a cell phone, get that baby out there, get it ready, turn it on. Because this is the first commitment we're asking you to make. Get your cell phone out and vote, right? So that's one, okay? That's one. Now, how many commitments, we're going to try to get a bead on intention here. How many commitments do you intend to make over the course of the next 3 days? Because that's how the world turns. That's how we strengthen partnerships. That's how we renew our commitment to aims and how we commit to new ones, right? So I want to invite you to vote. You can see there's 3 ways to vote. The easiest, I think, is to take that number and to text the unique code that's found to the left of each of these numbers. I'm going to be in the 10 plus category. Let me just say that. I'm going to go 10 plus. How many people here are going to join me in the 10 plus commitments over the course of the next 3 days? Get your hands up high. I just want to get a bead on sort of how many type A overachievers we have here. I'm going to guess maybe 5%. All right, so pick your number, get your number, line of sight there, and we're going to have another poll here as well in just a few moments. So I want you to, are the numbers a little small? Yeah, you might have to get somebody with spectacles to help if you're having a hard time with that. So we're going to move to our next polling question. Watching the clock here. This is an easy one. I'm kind of expecting 100% here, but you never know. If it's less than 100%, I'm expecting we're going to improve over the next 3 days. So we're going to win no matter what. So are you aware of the CMS Quality Payment Program? You can respond in 3 ways. There's that number that you can text. For yes, 25895. For no, 35895. And then there are 2 other ways. So if I could get your next answer to our second online poll, are you aware of the CMS Quality Payment Program? How about just a show of hands? How many people in this room? Let's get just a bead on that. Yeah, I kind of thought we're close to 100%. But if we're not at 100%, we will improve by day 3, and we're going to try this one more time then. Okay. So Couple of ending notes here. Aims create systems, and systems create results. And what you see on this slide are 4 sets of powerful aims, and they're not even all of our aims. There's a set of powerful aims around the Payment, Learning, and Action Network, new aims around the work of the Partnership for Patients to improve patient safety and to reduce 30-day readmissions. That set of color bands there means a lot to people in TCBI. We talk about these aims all the time. So those are the Transforming Clinical Practice Initiative aims in the upper right corner. And then this new one, 90% of eligible clinicians participate in the Quality Payment Program. These are powerful aims. You know, when I first started my career, I thought you had to build the system and then you could set aims. And I've learned that just the opposite is true. That you set aims and it causes the relationships. It causes the commitments to be entered into in new ways. It causes the systems to be built. You've heard us use the example over and over of President Kennedy said, in the early 60s, we're going to put a man on the moon and return him safely to Earth before this decade is out. That's what we're talking about. You set an aim, and through that aim, you build the system. That's at the heart of the work we're doing. And the beautiful thing about it is it's empowering, because when you commit to an aim for real, you decide how you're going to achieve it. You decide how you're going to deploy your time, your assets, your staff, your resources. It's different than top-down direction, and it's better. And we're doing it. If you think about it, look at this set of aims. This is how the Department of Health and Human Services is working to lead in the transformation of healthcare by setting powerful aims that people commit to and then deliver on. It's a joy to work in this way. Now, flipping to the non-work side, again, coaching from my staff, Dennis, there's a personal element to life as well, and we need to reflect on that. So in October, I went to Montauk, New York, and I had an aim. I wanted to catch big fish. And over the course of 2 days, with 4 other colleagues, we tried a lot of different ways. And we settled on a system that we called strenuous jigging. So you're in the back of a boat and you're jigging like this. And you can see that our aims created the systems that generated the results. Isn't that a beautiful striped bass? You ever see such a beautiful striped bass in your whole life? And Dr. Sherry Ling, our Deputy Chief Medical Officer, sitting right here, Dr. Ling, pointed out the fish in the bottom. See in the boat there? That's not the only big fish we caught. See those other ones there, right? And that's not the only day we went. So aims create systems, and systems create results, and it happens throughout life. So there's always with work the what and the how. We've talked a lot about the what, the work, the aims, the things that we aspire to. The how part is equally important, and this is our request to you for how to be over the course of the next 3 days. Renewing and recommitting to aims, engaged in contributing, nurturing resilience to tackle the next wave of change, which surely will be coming. Open, solution-seeking, authentic, and in-action-making requests and offers. Can I have a collective head nod? Can we agree that we're going to try to be this way together? Yeah? Yeah? How about this side? I'm not seeing it over here. Carol Wagner, are you with us? Yeah? Oh, great. Excellent. Thank you. Let's do this. Because when we think and act and do in a certain way, we generate momentum together. And this is an opportunity to renew, refresh, revitalize. Make the most of these 3 days. That's my request to you. Now, I have the great joy of introducing our next speaker, who, as I said earlier, is a nurse. She is insightful, thoughtful, one of my 3 bosses. I am absolutely delighted to call her one of my bosses. She is also the Deputy Director of the Center for Clinical Standards and Quality. And Jean Moody-Williams, join me in welcoming Jean Moody-Williams.
Thanks. Do I get to ring this thing?
Yeah, go for it. It's a lot of fun. Tell me if you want to use it.
Who gave that to him? Let's take a break. Thank you all for being here, and good morning to everyone. It's always so exciting when we start our quality conference and the energy that's in the room, and it continues throughout the course of our conference. And it's always my pleasure to open our conference with a panel that represents why we do the work that we do every day. And that it is really to ensure that all the people that reside in our country get the care they need to stay well, they're protected from avoidable harm, not exposed to unnecessary procedures and tests, and that their values are integrated into all of healthcare. We really want to make sure that the voices of patients, families, and caregivers are heard from the boardroom to the bedside. That's our goal. You Thus, the title for our panel today is From Framework to Action. We've worked for a number of years at this conference. As a matter of fact, as I was putting these remarks together, I started to reflect upon how long we've been working at patient and family engagement, and I started to get a little emotional as I was looking at where we're coming from. But we have really worked to develop a number of activities and frameworks over the course of the years that you've all been involved in. I've also participated in a number of activities over the past few months where we start to talk about frameworks and strategic plans. And I was just in a session with RWJ and the Gordon and Betty Moore Foundation in which the participants, which represented most of the major consumer advocacy organizations, asked, when are we going to stop talking about it and doing things? When can we get people to listen? I would venture to say that we have made a little bit more progress than you may realize. As I look back over the past few years, discussions about consumer engagement, patient and family, co-creation of goals, healthcare decision, and other areas, it's really becoming more a part of our day-to-day language and the way we think and do things. For example, I was at the Chick-fil-A one morning last week making an executive decision, chicken minis or egg and cheese biscuits. Yes, to my wellness friends, it was not a fruit and low-fat yogurt day. They generally have the USA Today on the counter, and actually I left it there at my chair. But I picked it up, and while I was waiting for my order, the headlines was about transparency of information and hospital star reporting. And I'm looking at this headline, I'm going to work, and I'm like, oh, okay, that sounds familiar. As I was reading it, there was someone in the line behind me on her cell phone, apparently talking to one of her staff about another staff member, and she was saying, I will not have those patients' wishes ignored in that manner. And doesn't she realize that what she was doing could cause a quality error? What if you didn't catch it? Or worse yet, what if someone from the government found out? I started to tap her, but I just went on. I then looked up on the wall, the flat screen was there, and there was a well-known health system in this area with the statements, we put patients at the center of all we do. And then there was a nurse talking about how they do that. But as I walked out with my egg and cheese biscuit, I felt ever so much hopeful, wondering if I was in a dream or the Twilight Zone or what was going on, because all around me there were things that related to patients and families. And so we are making progress. And while some of it is still just lip service, there are some very genuine efforts being made. And so I'm inspired by each of you and the audience, how you have stepped up over the years to begin to make a difference. On last week, we announced 2 models from the CMS Innovation Center that will increase patient engagement and decision-making. We're putting our money where our mouth is. And these 2, the beneficiary engagement and incentive models, are the shared decision-making models and the direct decision support models. Today, CMS is releasing the CMS Person and Family Engagement Strategy. We've worked on this for over the past 18 months, and many of you have helped. About 9 o'clock, it may be right about now, there's a blog that's being posted by Dr. Kate Goodrich expressing to the world our commitment to patient and family engagements. We have also released... Kate? So we've also released a summary, a consumer-friendly summary, and really we want to be leaders in CMS saying, you know, here's what we're going to do. What are you going to do? How are you going to step up the plate to make these real? I encourage you to look at those goals. They talk about not just looking at healthcare in the setting and silos, but in the communities in which we live, connecting with community organizations, shared decision-making, engagement in our policies and our practices. I'm really very proud of the work that we're doing. Now, We've also launched some consumer activities with the new quality payment program. Consumers have told us that they want advanced payment models that have them at the center. They want patient-reported outcomes, not just measures that are easy or available. They want improvement initiatives that make a difference to them, and access to their information through technology that supports their care. Our panel today is going to highlight how we move from a framework to action. Each of them have worked with CMS in one way or another, and I'm going to invite them to come to the stage as I introduce them. I'm actually honored to know each and every one of them. As I stated, I really wanted to stress that patients and families need to be involved in every aspect of care. Our first two panelists really drive this home as they work to ensure that quality measures that are used in our programs have been informed by patients. Lori Geary is an Associate Director of Quality Measurement Programs at CORE. She's an expert researcher and has extensive experience in directing quality measurement development with claims-based registries and other areas. And over the past 2 years, she's launched the CORE's Patient Engagement Group, ensuring that patients' voices contribute to healthcare quality. Jennifer Sweeney is Vice President of the National Partnership for Women and Families, where she leads the organization's patient and family portfolio. In her work, she's been working to make sure that the patient's voice is a part of our measurement development. Our next panelist is Maggie Carey, who's the chair of the Kidney Patient Advisory Council of the ESRD Forum and Network 11 Consumer Committee, and she has many responsibilities in that role. She's also the second of 4 family generations with polycystic kidney disease and is currently celebrating over 20 years as a transplant patient. She not only helps with program and policy, but she's also at the front line with patients and families and has become a dear friend of mine. And believe me, you have no choice but to listen to Maggie when she speaks. Dr. Darren DeWalt is the chief of the Division of General Medicine and Clinical Epidemiology and associate professor at the University of North Carolina at Chapel Hill. In other words, he has a big job. He is a practicing general internist researcher and quality improvement leader, and he really works toward quality improvement, health literacy, and patient-reported outcomes, and incorporates patient and family engagement in the work that he does. So we want to represent that it is a partnership. We need the clinicians, we need the patients, we need the policymakers, we need the program leaders if we're really going to have a comprehensive approach. So I'm going to stop and take some time to ask our panelists a few questions. As I mentioned with Lori and Jennifer, you all have been working really to engage the patient's voice into program design and policy and measurement development. Could you tell us a little bit more about what you've been doing in this area? I'll start with Lori.
Yes, sure, thank you. I think 2 ways we've worked really hard over the past 3 years with the National Partnership for Women and Families to really put framework into action. First, we developed a person and family engagement network. This is really a group of people that include patients, patient advocates, family caregivers, and other consumers of healthcare. We have a group now of over 40 individuals, and we hope to double that in the next year. So this is really a group of people at the ready to work with us and engage with us in all the work that we do. They're nationally represented, they have diverse backgrounds, they bring unique perspectives, and they're genuinely committed to doing this work with us. They all have jobs or other key priorities, and they're doing this for a very nominal honoraria because they're committed to improving healthcare. We train them, the National Partnership and CORE, we train them to engage with us on new measure development, reevaluation, preparing for NQF with special topics like sociodemographic status, and they also teach us a lot every day, and they're really genuinely our partners in development. The second thing is we worked with the National Partnership to also produce, it took us a year, a systematic process of patient engagement. Because it's not a check-the-box kind of thing, it really requires thoughtful, careful planning on how we're going to do it. And Jennifer, I think, is going to talk a little bit about the steps for that, so I won't go over that. But this process took us a year to develop, and it really ensures that CORE, across all of our teams at CORE, that we're systematically and in a standardized way engaging with patients to ensure that we're getting the authentic patient voice, which is harder than you might think.
Thank you. So Jennifer, I know you've been actively involved with this work. Could you tell us your perspective on it from a patient's perspective?
Sure, and really more from a consumer advocate. So at the National Partnership for Women and Families, my colleagues have been involved in measure development for nearly 20 years. Most of us have participated in measurement activities, sitting on measurement boards and bodies, typically serving as a consumer representative. And often we are, one or two people on a TAP. And while we have found that experience to be valuable, we knew we were just scratching the surface, and that if we wanted to get to a truly patient and family-centered healthcare system and to get to a place in which we have measures that matter to patients and families as well as other stakeholders, we needed to be more creative and find more meaningful ways to engage with patients and families. So we really jumped at the chance when Lori and her team came to us and said, how can we do this better? How can we truly partner? And I think that's really the word that I would emphasize today. This is not about necessarily just engagement. It's co-collaboration and it's partnership. And as Lori said, we created an entire process, and we built on a model that my colleagues and I have used out in the field to work collaboratively with patients and families and consumers and advocates for, again, nearly 20 years. And I think we've really seen an incredible impact with this work in a very short amount of time. As Lori said, it's not easy. There's certainly an investment of time and resources that are required, and our role has been really to identify, recruit, orient, onboard, and then engage the network members in meaningful ways. And I think we've seen great impact so far, so thank you.
Thank you. Yeah, Maggie, I know you've been involved with this for a while. Could you tell me a little bit more about how we're moving into action and things that are happening?
I can do that. As you said, I'm a patient. I'm actually the reason all of you have jobs. So, and I'm honored to be here and be able to speak for patients, but I can only speak from what I know, what I've observed, what I've been involved with. Patients are a diverse group. Very diverse. And I was happy to see a workshop on Wednesday at 3 dealing with racially and culturally diverse beneficiary voices, addressing health advocacy and rights. I'm going to be there. This is good. Get involved and hear other voices. From my perspective, from framework to action is a hard topic. There is no one answer, but there are some commonalities in patients that I think can be utilized. One is we've all suffered massive losses. Loss of our self-identity, loss of energy, loss of time. And I think if you want to engage patients, you're going to have to give some payback, because we're barely holding on as it is sometimes, and now you want us to sit on your TAP or your quality initiative program, and that's a wonderful thing, but we're trying to get out of bed and get dressed in the morning. So in order to engage us, we need some payback. And I think the best payback that you can give us sometimes is that self-definition that we've lost. Give us some self-pride again. Tell us why we're going to help, why we're going to feel better about ourselves, even if it's just a, certificate to put on the wall and look at a bad day. When you can engage us by our individual values, the sky is the limit from what we can do, what you can do with us, and it's a wonderful thing. We've seen it happen from the bedside to the boardroom, from the bedside in peer-to-peer mentoring, which is a huge initiative, but so beneficial, and there's an upswelling from patients. They want this. This should be harnessed and delivered on a national level. From peer-to-peer bedside mentoring, we're going into community. We're going into patient-led education. We're going into support systems, support groups. We're getting out through the community, and from the community, we're moving up to the nation through meetings with CMS, with affecting national policy, all the way to the White House, attending summits. I know, I've done all of this. I've been there, I've done this. It's being done. Not on a big scale yet, because we're a hard population to harness, but we're getting better at it, and the sky is the limit on where we're going from here.
Thanks, Maggie. Now, Darren, when I go out and speak to clinicians and I start talking about patient and family engagements, I'll frequently hear, but you're putting, from the clinicians, you're putting all the pressure on us. But Darren, you seem to have successfully managed to integrate partnership opportunities within your practice. Could you tell us a little bit more about that?
Yeah, thanks, Jean. And first I have to say you're brilliant by naming this from framework to action, because the only thing I know about frameworks is they're always wrong until you get to action, right? And then you sort them out as you go. They're not completely wrong. And so as a clinician and being responsible for running a practice, I find that to be successful with patient engagement, you need to think about 3 levels. And actually, I'm going to start saying patient partnership. I like Jennifer's term there. It's really more of a partnership. And for us in the practice, I think of the 3 levels as being on the policy level, the practice or system change level, and then on the personal level. And on the policy level, in our practice, and many practices have these, we have a patient advisory board, and really helping the patients understand the context in which we're practicing, being transparent about payment and performance, but also having them share in the ownership of that practice, not financially, but conceptually. But then that leads to, as we start to be transparent about what we're being measured on, whether it's technical quality metrics or patient experience, getting them engaged in helping us brainstorm and redesign our care systems. And I find that performance measurement is very focusing and for a practice, for physicians for sure, but also for patients and for our patient advisors. The 3rd level is on the personal level. And this is really what I think there are a lot of clinicians here. What we deal with day in and day out is when we're sitting in an exam room with an individual patient, and in the back of our mind are performance metrics, and in front of us is a patient that, as Maggie said, is somewhere on this very diverse spectrum, and trying to integrate what we know from performance metrics and what this patient's values and interests are. And I'll come back to more of that discussion, but I'm more and more convinced. I used to never even bring up performance measurement with patients, but I'm more and more convinced that our patients need to understand the context in which I'm practicing out of transparency and fairness to them, but that my job as a physician is really helping them integrate both what we know about the evidence, what we're measured on and paid on as doctors, and then what their values are.
So as all of you were talking, nearly all of you said, this is hard. So could you speak a little bit as we close on what the challenges are and what is it that we can do over the next 3 days to try and break down some of the barriers? If maybe you could just each take a minute to let us know what it is we need to be working on.
So from my perspective as a measure developer, I would say there are 2 takeaways for those that may be just starting this adventure of patient engagement, becoming experts in engaging with patients. The first is you need to find the right patient engagement expert to partner with, because you can't do this alone. For us, that was the National Partnership for Women and Families. They really just bring so much to the table. You don't really know what you don't know, so they know this stakeholder group. They speak the language. They know what resonates with this group. They taught us what to do and what not to do, and when to do it and when not to do it. And they were honest with us when we did it, when we messed up. So you really need to partner with someone who's going to be honest with you. And they were also committed to learning the work that we do at CORE so they could be most effective in their role. They also bring important established relationships in the patient community, in the patient advocacy communities, and that really helps to mitigate some of the recruitment challenges, because if you talk to any measure developer, that is the one thing that comes up over and over again, recruiting the right people with the right experience and expertise is so hard. The second thing is prepare your organization for a cultural shift. As measure developers, we all think we know what we're doing and we're doing it great and we're leaders in our field, and then all of a sudden you have someone like Jennifer saying, you're not doing that the right way. So it's a little bit humbling, and it really does change everything. It changes the processes that we use for measure development and reevaluation. It changes the dialogue, and it compresses already super tight timelines, and it challenges the commitment of even your most earnest leadership and staff. It really is a big change in the way you do everything. So it's really important to keep your eye on the prize and focus on the benefits, the remarkable benefits and impact that it can have to keep morale up.
Thank you for that. And would you like to add to that, Jennifer?
I promise I will not tell you you're doing things wrong if you work with us. So I think I'll sort of take a page from Dennis's book around requests and offers. I think in terms of a request, I would ask that if you are a measure developer in the room and you're interested in partnering in more meaningful ways with patients and families, or ensuring that the end results of your work really meet the needs of patients and families, that you explore more meaningful partnerships. And in terms of an offer, I would say that because my team and I have been doing this work for a while, we've honed a set of best practices, we have an engagement model that works, I am very open to working with any of you to share with you what we've learned and to help you along the way as you tackle this work.
Thank you. Maggie?
I'll be short and sweet on this. Recognize the values that patients have. Recognize that they're individual for patients and they probably don't align with your values. There's a whole group of patients right over there. This next 3 days, talk to the patients, find out the diversity of what's important to them, and then look at ways to fill the void and to utilize their strengths.
And you get to the last word on this.
I think, to me, the challenge that I face as a clinician is reconciling population-based metrics with the individual patient in front of me. And as Maggie said, patients have diverse interests and values. And I guess my challenge is to all of us as a quality improvement policymakers and implementers is to think more about how our metrics can be designed so that they meet the needs of the individual patient in front of us. I see a world in the future where patients really decide on the metrics at which they and us together in the dyad, clinician dyad, are being measured.
Thank you for all that insight, and thank you for the work that you're doing. It's tremendous as you can see, it's just a part of our day-to-day activity that we do now, and becoming more so. There are a number of sessions that you can attend throughout the conference that have a focus, but I would say, even though we have some sessions that are called out, every single session that's on our agenda ought to have the needs, the partnerships of our patients, our families, and caregivers integrated. So feel free, if you're in the room and you want to bring the topic up, you have my permission to do so. And thank you all for coming, and we are looking forward to spending time with you the rest of the next 3 days. Thank you.
Ladies and gentlemen, please welcome Dr. Kate Goodrich, Director, Center for Clinical Standards and Quality, and change the graphic. Change it.
It starts with a V. Mystery guest. Mystery guest. Vicki Joaquino, everybody. Director of the Center for Medicaid and CHIP Services. I'll just save you for that one. So I am just so excited to be here today to join my colleagues Dennis Wagner, Jean Moody-Williams, and Vicki Joaquino in welcoming you to the 2016 Quality Conference. This is my second conference since becoming director of the Center for Clinical Standards and Quality, and my fifth overall. And I really felt walking into this or preparing for this conference that it was going to be really tough to top last year's conference, which honestly was one of the most energizing conferences of any type that I have ever been to. But I really want to emphasize something Dennis said, which is about having fun. There's a lot more work to continue. There's a lot to celebrate from these last few years, and particularly this last year. And I just think it's going to be just as energetic and fun as we've had in years past, if not more. So I want to start off by thanking you all for the incredibly hard work over the last year, and in particular for the results that you all have generated already. Throughout this past year, I've done a lot of traveling. I've gone to several of the CMS regions. I've attended numerous conferences, and in doing that, I've met with many of you in this room. And I am always just so impressed with your commitments to patients and families, to collaboration with one another. We talked an awful lot about collaboration last year. And of course, to the overall mission of better care, better health for communities, and smarter spending. And you all live that every single day, and it absolutely shows. And now, while our overall shared work and goals continue each year, it does seem that pretty much every year we have new priorities, we have new programs, new work and commitments that we want to talk about and share with you all. And of course, this year is no exception. We are about to launch a new little program that you've probably heard about and that Dennis referenced, the Quality Payment Program. We finalized our first regulation in October of this year, and the first performance period opens on January 1st of 2017. And I think that those of you who have been participants in the development of the program, or who have read the regulation or gone to our website, or have just had any role at all in the last year, have probably noticed that our approach to the QPP has been somewhat different from many of our other value-based purchasing programs. You know, at CMS, we do always pride ourselves, I think Jean mentioned this, we do pride ourselves at our engagement activities and how much we work with our stakeholders, from policy development to program launch, listening to their needs and concerns. But this year, I think that we really put that on steroids. We accelerated and expanded our engagement activities to new levels and used new approaches. So, we've always had our national provider calls and our open door forums, and several of us will travel across the country and give talks, and some of you come to CMS and talk to us. But this year, we did things a little bit differently. We did all of that, but we also got out of our offices in Baltimore Central Office or in the regions, and we went into doctors' and nurses' offices to talk to them. We heard from them what was working with the what we now call the legacy programs, what was working and what isn't working, what expectations that we're putting on clinicians is realistic and which ones aren't. What are the pain points? We actually sat there and watched clinicians as they reported quality measures or for meaningful use, and we saw and felt their pain points. And I will tell you, it was not always easy to hear what they had to say about CMS, but that was important for us to hear. And we are now spending more and more time with patients and consumers, as Jean mentioned, to hear their reactions to our the initial regulation and years of the program, and importantly, hearing from them how we can ensure that over the life of the program that we do keep the patient at the center and that we can work with clinicians to drive better outcomes for patients. So one of the first things that we did at CMS when we began working on the QPP was to develop a strategic plan with goals, objectives, and metrics. And I'm sure that it will not surprise anyone in this room to know that Jean Moody-Williams actually led that effort. She's our Chief Strategy Officer, as well as our Chief Communications Officer, Engagement Officer. She has a lot of roles in QPP. So one of our top two objectives, really, we have about 7 objectives, but the 2 that I want to mention to you that are really important are, of course, developing a program that improves health outcomes for patients, but also a program that minimizes burden for clinicians by giving them the tools that they need in order to provide the highest quality care for patients. We think that reducing burden and providing help and tools will actually help them take good care of their patients. But in order to do that, that means that clinicians have to participate in the program. And so, as Dennis mentioned, to that end, our first metric that we developed for the QPP was getting at least 90% participation by eligible clinicians. And so, our very first ask for you is to share in that goal for our networks who are working directly with clinical practices, so the Quinn QIOs, Transforming Clinical Practice Initiative, and soon the small, underserved, and rural support that will be coming soon. So we want you all to commit to this goal with us of getting 90% participation in the QPP. So how do we do that? So we started by trying to create policies that are flexible and meaningful to clinicians. We developed the transition year where clinicians can pick their pace for how they want to participate in the program depending upon their state of readiness to participate in the program. We created a totally awesome website that I hope you all go to that gives information to people, that information that they want and in a way that they can understand. And over time will develop to really be the central place that clinicians and practice managers and others can go to get information about the program. And now we have to make it easy for clinicians to join the program, and they have to find value in it and believe that they can be successful. They have to understand what it is that they have to do in order to be successful. So to that end, Administrator Slavitt has led our agency in a commitment to provide exceptional customer service to clinicians who need help. And so our second ask is that our networks align with our QPP goals with our service center. And notice we're not using the term help desk anymore. We're calling it a service center because it's really all about customer service and customer relations management. We want the networks to align with our approach to customer service. So these include things like getting back to people within 24 hours of any incoming calls or requests to the CMS Service Center or any other point of entry, including, of course, all the networks. We have got to take a no wrong door approach, and you'll be hearing a lot about this over the next 3 days, where clinicians who call any network are very quickly and effectively connected to the right network, no matter what their original point of entry is. And we have to ensure that 100% of eligible clinicians have access to technical assistance and that the help that they are offered actually works, that it actually satisfies their needs. And so we're going to have a lot of discussions over the coming 3 days about these goals. So we are very much looking forward to your input as to how we can achieve these goals and operationalize this approach. Now, I know that QPP is currently sort of the sexy program at CMS. It is certainly a major theme of this conference, and it's clearly been one of the top priorities for us at CMS. I do want to make clear, however, that the ongoing work with hospitals, dialysis facilities, nursing homes, and other settings remains as critical and important as ever. There is still so much more work to do. And we've kind of tackled the low-hanging fruit, and what's left is the really, really hard stuff. And I have often been asked as I'm out traveling and talking to folks about how the work that we're doing within all of our different networks and with QPP aligns with all of the different networks, ESRD networks, HINs, QIOs. And remember that increasingly, providers and others within the healthcare system are not just focused on a single setting. You know, the healthcare system is really driving, to be all-encompassing and more holistic and less about silos of care. And we've been helping to drive that, and so it's natural that people are asking us those questions. And the answer is that we have very purposefully taken an approach that we know works from our collective experience with all of you, with the Quinn QIOs, with the HINs, the ESRD networks, and we are applying that to the QPP work of the PTN, SANS, of course the Quins, and soon the SIRS networks. And so I want to give you a tangible example of that. One of the most important examples of what we know works and we are spreading to the clinical practice technical assistance networks is the smart use of data. There is very little that is more critical to successful improvement efforts than the ability to generate reliable and actionable data on quality and outcomes for frontline providers, to have ready access to those data, to be able to make meaning of the data, to allow the data to tell a story that makes sense to providers and to patients, and to use those data to improve, and then repeat. Smart use of data is absolutely foundational to improvement and to practice transformation. And those of you in the HIN and Quinn QIO networks and the ESRD networks have a wealth of experience in the use of data for improvement over many, many years. And you, I know, have learned that you can never have enough of it because you're always asking us for more, and because it is absolutely necessary to generating results. And so use of data for improvement is a core tenet of the TCPI and the upcoming SIRS work. as we have learned, again, that it's critical for success. And this is just but one area where we would ask that our networks collaborate with one another to spread best practices. And so finally, I do want to build a little bit on Dennis's words about the current environment and the transition that is underway. I think the most important message I have for you is that we just have to keep working. We just have to keep doing what we're doing. Our purpose and our mission has not changed. We are all here to improve care for patients and families and to transform the healthcare system. And remember, improvement of patient care, improvement of quality and outcome isn't partisan. In fact, it's actually probably bipartisan, as we have seen from the overwhelming bipartisan support for the macro legislation that launched the QPP, the recently passed First Century Cures bill. We need you all to remain focused and effective in delivering on your contract and cooperative agreement commitments to outcomes, cost savings, better outcomes for patients. We are going to keep doing our work as established under various statutes and regulations. And as federal civil servants, we will be responsive as our leadership changes. There will be change, undoubtedly, just as Dennis said, over the next several years. And our goal is to help our agency be as successful as possible in carrying out its mission. And at the end of the day, it's really hard to go wrong when you keep the patient at the center of your work. What is best for patients and families must remain at the core of all that we do, and I know that if we do that, we will continue to be as successful as we have been. So I want to thank you all again for being here this week, and especially for your work over the last year. I am really looking forward to interacting with many of you over the next 3 days, and I hope that you do have fun. I hope that you learn something from somebody, and I hope that you teach something to somebody, and that you make commitments to one another to share experiences and to focus on results. And now I'd like to turn the podium over to my colleague Vicki Joaquino, again, Director of the Center for Medicaid and CHIP Services. Thank you very much.
Thank you. Good morning. It is so fitting that the Quality Conference occurs so close to the holidays, because I have to tell you, the staff at CMCS, my Medicaid and CHIP staff, looks forward to this all year and plans for it all year. And judging from the response we got to this year's event, you do too, because I have got to tell you, this was the hottest ticket since Hamilton. We had to turn people away. So thank you all for your enthusiasm and interest and for being here this morning. I wanted to just spend a little bit of time talking about how the work you do matters to the Medicaid and CHIP programs. Medicaid, as you know, is the health insurance program for low-income Americans in America, and it stands today more than 70 million people strong. And that means that your work matters to more than 32 million American children, to more than 18 million seniors and people with disabilities, and to more than 20 million non-disabled, non-senior adults. It's a remarkable program. It serves now 16% of all Americans. And according to CMS's recently released data, funds 17% of all services in the healthcare system, which means that when you work on Medicaid and CHIP, your work has an impact throughout the healthcare system. So I wanted to spend a little bit of time reflecting on 3 foundations that we have laid for quality and delivery system progress over the past 8 years, and then talk about 3 ways in which you will be leveraging that work today, tomorrow, the next day, and into the future. The first foundation stone that we laid was establishing quality measurement for both children and adults in the Medicaid program. 8 years ago, we did not systematically measure and manage quality of care. But we now have core measure sets for children on which every state is reporting, and we have core measure sets for adults on which 39 states are reporting, and we're going to keep moving forward with those measurement efforts. The second foundation stone that we laid just this year was our new managed care regulations. 3/4 of all Medicaid beneficiaries are enrolled in managed care, which makes managed care by far the dominant delivery system in Medicaid. Moving forward with quality of care was a pivotal aspect of our new regulation. We not only extended Medicaid's focus on quality strategies and on increasing transparency and on making sure that we're taking into account health disparities and critical services like long-term services and supports in measuring quality. We also established the first ever quality rating system for Medicaid and CHIP, equivalent to that exists for the marketplace coverage. And today, we will be conducting the first significant stakeholder input session for the quality rating system. So if you, just this morning, take the time to go to that session, you can actually help us build the quality rating system for Medicaid and CHIP. The third cornerstone we laid was building a better platform for delivery system reform in Medicaid. So let's take a look at the results. Right now, 8 states participate, Medicaid programs participate in the Comprehensive Primary Care Plus initiative. So they're strengthening primary care for Medicaid beneficiaries today. More than 30 states participate in Strong Start, building stronger maternal and prenatal care for new moms and their babies. Just this fall, we approved 3 groundbreaking new delivery system models in 3 states, Massachusetts, Vermont, and Rhode Island, and those are getting stood up now. And of course, we've built a platform for all states to work with CMS to move forward with delivery system reform through our Innovation Accelerator program, which just this month we're expanding to new areas like payment methods, data analytics, and we're also expanding this focus on maternity care and oral health care. Now, building on Jean's observation that frameworks are one thing, action is another. Really, your work today and going forward is about turning those foundation stones into action. And here's 3 ways that we're going to do this over the next few days. The first is maternity care. Medicaid is the nation's leading purchaser of maternity and prenatal care. And so we and you have invested an enormous amount in making that care as strong as possible so new babies can get off to their best start in life and new moms can be supported in that important endeavor of parenthood. So if you come to our maternal and infant health session, you can hear states and how they're moving forward. You can hear from Oklahoma, which is using Text for Baby to make sure new moms enroll and know what they need to do to get prenatal care. You can hear from South Carolina, which is pioneering better payment methods for maternity care. A second key area for us is obviously substance use disorder. No one in this room has to be told that we as a country face a serious epidemic of opiate abuse. In the Medicaid program, somewhere between 25 and 29% of all beneficiaries have a serious mental health or substance use need. So that's an obvious area that we have committed to. And this afternoon or over the next few days, you can hear more about how we're working with states to develop comprehensive approaches to strengthening our approach to substance use disorder to help people get treatment. And come here from Virginia, which is the state we're working most intensively with right now on a pioneering approach using 1115 waiver authority to taking up a full continuum of services for care for Medicaid beneficiaries. The last area that to bring to your attention as us having made a really significant commitment to is moving forward with community-based long-term services and supports. We were proud a few years ago when we finally reached the turning point in the Medicaid program where we were spending more on services in home and community-based settings than we were on institutional care. That change was a long time in coming and was the result of decades of progress and hard work on the part of CMS and states and stakeholders. But even as we were celebrating that milestone, my team was asking themselves, what more can we do? What do we need to do to accelerate progress? And one of the key tools that they landed on was trying to advance new payment methods. So taking the principles of value-based purchasing and applying them to community-based long-term services and supports to propel progress forward. So in this session, you can hear Pennsylvania talking about their approach to having stronger payment methods for long-term services and supports. So it's been 8 years of remarkable commitment and progress to strengthening quality and delivery systems in Medicaid and CHIP. but I feel my remarks would be somehow incomplete without acknowledging the uncertainty that is on the horizon. Over the next few weeks and months, we will face choices about whether we're going to continue this progress that we've made on coverage and quality or whether we are going backwards. One way we could go backwards is to repeal the Affordable Care Act, which would take away coverage from millions of Americans. Another way of going backwards is by block granting or capping Medicaid funding, letting the federal government step back from its funding commitment and cutting back on funding for the Medicaid program. Both of those changes would have negative impacts on coverage, and because coverage is really the foundation of quality, would also impede the work that we have all been doing to build stronger quality and systems of care for millions of Americans, including millions of Medicaid beneficiaries. Now, the good news, as you've heard from Kate and others, is that the CMS team will be here throughout to support and to keep moving forward. I wanted to, though, since I am one of the few CMS employees whose CMS career is coming to an end, to end by thanking you all on the behalf of the Medicaid and CHIP programs, our 70 million beneficiaries, and on behalf of the administration. We have had an unbelievable commitment from states, from providers, from advocates, and from consumers in strengthening the Medicaid coverage and the Medicaid program is historic and unprecedented, and we could not have done it without you. So thank you for all you're going to do, all you have done these past 8 years, all you're going to do over these next 3 days, and everything that's to come. We appreciate your hard work and commitment and everything you've done for America's low-income residents.
I'm going to introduce the next one. Thanks so much, Vicki. So it is now my pleasure to introduce our next speaker, Ned Holland. So Ned most recently served as the Assistant Secretary for Administration in the Department of Health and Human Services, which he held from 2009 to 2015. And in that role, Ned was responsible for the leadership and management of approximately 3,800 federal employees and contractors operating 12 separate budgets, totaling almost $1.4 billion with a B dollars. And that included the Program Support Center, which is the largest shared services organization in the federal government. Ned has held other many distinguished and executive positions, including being Senior Vice President of Human Resources and Communication for Embark Corporation, Vice President for Compensation, Benefits, Labor, and Employee Relations at Sprint, and he was Managing Partner of a health law firm in Kansas City. Ned retired in 2015, although looking here, it doesn't seem like he's really retired. He's still doing quite a bit of work, including serving on a couple of different boards, including for the American Academy of Family Physicians Foundation. And he does volunteer work for, among others, the Fairfax County Public School System, as well as the Partnership for Public Service. And so I give you Ned Holland. Thanks, Ned. Nice to see you.
Okay, thank you very much. I am truly pleased to be here this morning on behalf of the Partnership for Public Service. I serve as a senior advisor to government executives. The acronym is SAGE. I don't think I merit that. And I today represent Max Steyer, the CEO of the partnership, who's a friend and colleague. He regrets that he could not be here today, but he asked me to send his regards. Additionally, I'm particularly pleased to be with CMS because I had the opportunity, as Kate just mentioned, to work with this institution for a number of years. In fact, for 6 years and a few months, my next door neighbor at the Department of Health and Human Services was the administrator of CMS, first Don Berwick, then Marilyn Tavener, and most recently Andy Slavitt. So I get to know those folks pretty well. In that role, I was part of the executive group which regularly oversaw and evaluated the work we are going to honor today. I watched the Partnership for Patients develop, grow, and be successful, and I got to see it from a perspective that almost no one else, or at least a very small group of us, got to do. First, I want to say just a little bit about the Partnership for Public Service. I believe it's one of the most important non-government entities in Washington, D.C. Its mission is to help our government be more effective for the American people, be more effective for the American people. That means getting the best talent into government, and the partnership focuses a lot on talent and employees and providing support for federal employees. With our unique quadrennial transfer of power coming in about 34 days, the success of the new administration will depend in large measure on the capacity of almost 2 million career federal employees. And for those of us who are no longer or never have been federal employees, I think it's important to recognize those folks. The work of the partnership also entails getting great talent engaged and motivated. And in fact, this week, the partnership will be releasing its 2016 version of Best Places to Work in the Federal Government. You'll see that later this week in the Washington Post. Named for the partnership's founder, Samuel J. Heyman, the Service to America Awards, as they call them, the Sammys, began 15 years ago to recognize and celebrate the good things happening in the federal government. Too often, we only talk about the bad things and we don't recognize all the good things that happen, and they are legion. The Sammys are intended to highlight the excellence of our federal workforce and to inspire other talented and dedicated individuals to join that effort. By the way, nominations for 2017 now are open. If you have a favorite federal employee and you want to recognize them, I suggest you go to the partnership's website and you can nominate people there. There are other key initiatives of the partnership. They include advocating for needed legislative and regulatory reforms to strengthen the civil service, provide assistance to federal agencies. They've done it for the Department of Health and Human Services at my request, to improve their management and operations and strengthen their leadership capacity. The partnership conducts outreach to college campuses and job seekers to promote public service, and it generates research on and responses to the workforce challenges that face our federal government. The Sammys themselves recognize the very best work in the federal government. The fact that the work we recognize today was done in close collaboration with other federal partners, with private partners, and importantly, those of you over that corner, with patients and families from across the nation truly is extraordinary. It's not the kind of thing we always see done in the government, and it deserves extraordinary recognition. This is how major life-saving, life-enhancing, and cost-saving results are generated in this great democratic society we call the United States of America. All of you in the room should be proud of the extraordinary work and the accomplishments you've achieved. Dennis Wagner, Paul McGann, Jean Moody Williams were honored as the Sammys 2016 Federal Employees of the Year. By the way, I might mention the 5th year in a row a federal Health and Human Services employee was so honored. The team created a unique, and I use that word advisedly, it is unique, public-private initiative at the Centers for Medicare and Medicaid Services to increase hospital safety and reduce patient readmissions. Launched in 2011, the Partnership for Patients is a partnership of physicians, nurses, hospitals, and employees who work together on behalf of patients. By incorporating the perspective of patients and their families and spreading the successful practices of high-performing hospitals, the initiative works to prevent the tens of thousands of deaths that occur every year as a result of preventable medical errors. Today, we celebrate the outcomes all of you generated, all of you, that resulted in the Employee of the Year award for Jean, Paul, and Dennis. I'd note over 2 million fewer patient harms, nearly $20 billion in cost savings, and most importantly, approximately 87,000 lives saved. The partnership knows, as do Jean, Paul, and Dennis, that these results come from the work of many leaders and organizations from across the nation, including many of you here today. Today, the partnership and I join with Jean, Paul, Dennis, and CMS in recognizing the contributions of those who truly did the hard work and the heavy lifting in the field, which is where, after all, healthcare is delivered. Patients and families who have teamed with us on this work, people like Barb and Bob Malizio, from whom you will hear in just a few minutes. Key leaders and staff from other federal partners, the Administration for Healthcare Research and Quality, the Centers for Disease Control, the Veterans Administration, Health Resources and Services Administration, Administration for Community Living, and others. And key leaders from the 53 quality improvement organizations and 14 Quinn QIOs across the country. Also key leaders and staff from the hospital engagement networks, plus or minus 60 funded contractors and subcontractors of CMS who have worked since 2011 exclusively on hospital patient safety and readmissions. They include organizations like the American Hospital Association, the Minnesota Hospital Association, Carolinas Health System, Dignity Health, and many others. And of course, key leaders from the partnership organizations like the American Nurses Association, the National Partnership for Women and Families, and others. And finally, but certainly not least, more than 100 staff and leaders from CMS. On behalf of the partnership and my old office at the Department of Health and Human Services, I offer my congratulations to each and every one of you for what you have achieved. And now we're going to see a video that the partnership prepared to celebrate this year's highest partnership award, the Federal Employees of the Year.
Hospitals are actually very dangerous places. There are significant interventions that hospitals make to improve the health of their patients, but many of those things are hazardous. So as a result, hospitals are places where there are very serious infections that you can get from the hospital. You as a patient expect a system to be in place and a culture to be in place that you don't get harmed by the hospital when you're there.
The number of patients that are harmed or even die from adverse events of their care in American hospitals is thought to be over 100,000 deaths per year. So this is a very serious problem in American healthcare.
The Partnership for Patient Initiative is just an extremely exciting effort where a number of parties are coming together to work to reduce harm. We work with physicians and nurses, pharmacists, all of those that have anything to do with care in the hospital to improve care. In addition to that, we work with patients and families, and so they're very much involved in the improvement efforts.
My oldest granddaughter, Michelle's oldest daughter now, will be 16 in September. And this was probably when she was about 10, about 3 years after she lost her mother, and we were getting involved and going around speaking and that, you know. And she started asking me, well, Grandma, what do you do when you go to these meetings? I said, well, we talk about what happened to Mom and the changes so, you know, it won't happen to someone else. And she says, really? She said, well, how many people do you talk to? And I said, oh, sometimes there's 50, sometimes there's over 1,000. She said, and they all know my mom? And I says, yes. She says, wow, my mom's famous, isn't she?
One of the exciting things they've taught us is that, in fact, it's not possible to drive safety to unprecedented low levels of harm without having patients by our side, not just in the room and in the hospital, but in the design of safety systems and on the boards of hospital, right by our side every step of the way.
I think our involvement has helped us heal because we see the hard work that people are putting forward to change healthcare.
We have measurable results from the Partnership for Patient that we all celebrate along with the entire country. Nearly 21 million harms have been prevented. Billions of dollars have been saved. Over 87,000 lives have been saved. And when you look at that impact, you can't help but be proud of the work that everyone's done. And you think of the families and the children and the seniors that have been impacted, because it's not about the numbers, it's about the people.
Ladies and gentlemen, please welcome Bob and Barb Melizzo. Bob and Barb lost their daughter to a medical error. They came to Quality Conference way back in 2011 to challenge us to work hard to improve patient safety in hospitals. They are here today to help us recognize those who are succeeding in this work.
Well, thank you very much. We are honored to be here. My wife told me that I should speak because I have a big mouth. And after almost 50 years of marriage, you listen to your wife. We got married right out of grade school. It's been a journey. We lost our daughter due to a preventable medical error. She expressed her concerns, and no one listened. She asked for an anesthesiologist to be present when she had a minor procedure. Because 2 weeks prior, having the same procedure, midway through she woke up and she was concerned. But they didn't listen. We became patient advocates because of this, because of losing our child. A caring and loving mother of two, who her and her husband had just purchased a new home. Her children have to be brought up without her. We saw how the health care was. I've been a patient for many years. I have a bad heart. But we see the advances that have been made in the last 6 years. Since we were asked by Dennis and Paul and Jean to join this effort of patient and family engagement, reduce preventable harm. So, when I was trying to decide how to address you today, I thought of my daughter, or our daughter. And I imagined sitting down with her and being the caring and loving person that she was. I imagined her saying to us, "Dad, you go there. You go to that meeting and you tell those people, can't stop now. The ball is rolling, Dad. It's rolling in the right direction. And we need them to continue. Culture change is happening. 6 years ago, we didn't know if it would. But because of your persistence, it's changing. She said, you know, Dad, there's a lot of us up here that don't want to be here. And only those people that you're talking to can make a difference. There's millions of people out there, Dad, that are depending on those people to continue this journey through, to reduce harm in healthcare. They've come a long way, Dad. But we still have a long way to go. And you tell them, Dad, you tell them, for all of us up here, thank you. Thank you for your commitment, your perseverance, and your dedication. And on behalf of all the patient advocates across the United States that are working so hard to see this change through, we want to say thank you. Thank you so much.
Ladies and gentlemen, please welcome back Dennis, Jean, and Dr. Paul McGann, Chief Medical Officer of Quality Improvement, CMS.
Now I know why Dennis said, you speak first. Kind of hard to pull yourself together after that. But we appreciate those words and the reminder that the work that we're doing must continue for all of the people that we work for our own family, and for ourselves as we enter into the healthcare system. Now, we wanted to take a moment because while we were the recipients of the award, we received it on behalf of all of you. And we celebrated some at CMS on yesterday. But as we were thinking about it several months ago, how can we show our appreciation for all the work that everybody else has done? And talking and going over it, we said, we know, we can celebrate them at the quality conference. And you know, when you work with Dennis, he's like, we can give everybody an award. I'm like, how can we do that? But we are. So for that, we're going to acknowledge some of the folks that have really had a great hand in this, and turn it to Paul to say a little bit more.
On behalf of the group here, and also Bob and Barb Melizzo and Ned Holland, we just want to thank you very much. This award means a lot to us, but I hope it means a lot to every single person in this audience. The work you did is what made these results happen. And when we get to the award part, you're going to see there aren't many awards that have 3 big numbers on them. And these awards have 3 big numbers on them. And the most important number of all is that through 2014, 87,000 lives were saved because of the work and the commitment that you've had over the last 4 years. And when you So when you're with your families this holiday season, think of that. That's 87,000 more people that are with their families this holiday season than would have been there without the work that you did. And remember also what Bob and Barb just told us. As much as we've done, there's a lot more work to be done. And they say one of the great things for resilience, Dennis, and getting on in the future, especially through change, is to have purpose in life. I can't think of a better way to have purpose in anybody's job than to work to get the number of harms down to 0. So thank you, Bob and Barb.
So on behalf of the 3 of us, my job here is logistics. So we've all been part of ceremonies where you recognize several hundred people. And what we have over here on this table are several hundred plaques. Okay?
So Dennis, should we call them up one by one?
What do you think? Yeah.
Might work, like
That'd
a
be good, huh?
commencement
Yeah.
exercise.
Couple hours, right?
Yeah. So we're not going to do that. Yeah, there you go. We're going to do something different. So I'd explain what we're going to do because this requires your help, all right? This isn't going to be names across the stage. We got this table of several hundred plaques over here, and I want to thank the people who are standing by these plaques. These are patients. These are patients. Now, in advance of this ceremony, we sent out emails and had people call lots of folks. You heard Ned Holland speak earlier about the leaders of each of the hospital engagement networks, including those hospital engagement networks that are subcontractors, the American Hospital Association with all the state hospital associations, the 53 quality improvement organizations, some of whom are now Quinn QIOs, patient and family advocates, federal partners like Noel Eldridge, who works on the ARC scorecard with Rear Admiral Jeff Brady over in AHRQ, many others. So advance notice was sent to a couple hundred people, and these chairs up front were reserved for those people. Now, I'm a little worried because a lot of these chairs are empty, and I have a feeling you're back there somewhere. Now, I don't know for sure, but let me just do this real quick. How many people got advance notice that they're going to receive one of these plaques on behalf of their organization or themselves? All right, I see a concentration over here and a few folks over there. So what I'm going to do in a few moments is I'm going to ask those of you that have been designated to receive one of these plaques on behalf of your organizations, recognizing virtually everyone here in the room. I'm going to ask you to stand up, and these patients, and kind of get ready for a little pandemonium, all right? This is going to be messy. This is going to be a little bit chaotic, but that's what partnership and teamwork and synergy looks like, right? That's what it looks like. So we're gonna do that. So I'm asking you to stand up, and then these folks are going to work to get your plaque to you. And these plaques are, for the most part, highly personalized, so they have names of organizations and individuals on them to recognize your achievement. That's what we're going to do. And I want to say this, when a patient rep hands you a plaque, and you may want to have team members over there next to you, that's fine. You can take photos, so pandemonium and photos, and congratulations. Somebody might want to grab Bob and Barb Melisa to join with them for some of those photos. Like, it's all fair game. We're going to do this for 10 minutes, and then we're all going to sit down and recollect, okay? So 10 minutes of pandemonium while all this happens. Now, I also want to extend an invitation. Ned Holland has agreed on behalf of the partnership to stay with us from noon to 1 today to take photos in the Bristol room. So if you receive one of these plaques and you want to bring your team in with you and get a photo with Ned Holland and Jean and Paul and myself, we'll be at the Bristol room from 12 to 1. And then again this evening in the Bristol room from 5 to 6:30, although I'm not sure, Ned, you're not going to be here at 5, 6:30, I don't think. No. All right. But we'll be there for photos from 5 to 6:30 this evening as well, if you'd like one. No requirement, up to you. All right. So those of you So 10 minutes pandemonium, get ready for that. Nobody leave, we're gonna reconvene, okay? So if you're designated to receive a plaque, please stand up, and patient partners, please hand them out.
Are they in alphabetical order?
Huh?
Are they alphabetical order?
Oh, they are.
No,
Oh, I
are
should
they?
have said that, they are, yes.
Okay, so are they,
Ladies and gentlemen, the time is 10:10. The mid-morning break begins in 5 minutes.
Frank? Okay, ladies and gentlemen, if I could have your attention, please turn and face the stage. We are about to wrap up this session. If I could have you come back to the full group. All right, thank you. I warned you there'd be a little bit of pandemonium here, and I think we've successfully achieved that goal. And what I would like to request that everyone do is please stand and face me. If you can hear the sound of my voice, clap your hands once. If you can hear the sound of my voice, clap your hands twice. If you can hear the sound of my voice, clap your hands 3 times. All right, we're going to take one group photo right now. So face the stage. Our photographer here is on the stage. If you received a plaque, hold it high. Hold your plaque high. Hold your plaque high. Very good. So we're going to get a group photo right now. Hold your plaque high. That's beautiful. That is beautiful. Give these folks a hand. Got it? So Jean and Paul and I, in closing, want to say one thing. You can, if you want to bring light into the world, you can either be the candle that makes the light or the mirror that amplifies and reflects it. And we had the great joy as the recipients of this award to be the mirrors that reflect and amplify the light that you're generating to improve hospital patient safety in the United States. Thank you, and you can go to your mini plenaries.